What if I told you that a medical system that's over 1,000 years old might hold the key to a modern skin problem, one that even powerful steroids can't seem to solve? Well, today we're going to dive into an amazing story that does just that, bridging ancient wisdom with very modern relief.
This quote, wow, it just gets right to the heart of it, doesn't it? This is what a patient said about living with a condition called Lichen Planus, and it tells you everything you need to know. This isn't just some rash. It's not just skin deep. It's an intense, relentless, and totally draining battle against your own body.
And you know, this battle, it's being fought by 1% of the entire world's population. Now, 1% might not sound like a huge number at first, but think about it. That's millions and millions of people losing sleep, struggling to focus at work, and just feeling awful in their own skin because of this crazy-making itch.
So what exactly is this condition that causes so much misery? Let's break down the basics of Lichen Planus.
Okay, so at its core, Lichen Planus is an inflammatory disorder. And here's the tricky part. In Western medicine, they don't really have a definitive cause. Sometimes it's linked to certain medications, maybe a virus like hepatitis C. Some even think it's an autoimmune reaction. But for most people, the cause is a total mystery. The one thing that isn't a mystery, the defining symptom, which is a profoundly intense, unbearable itch.
So how do doctors even spot this? Well, it's actually pretty cool. They use a simple but really effective memory trick, the 5 Ps. The bumps themselves, or papules, are pruritic. That's the crazy itch we're talking about. They're purple in color. They're polygonal, meaning they have many sides, kind of like a stop sign. They're planar, so they're flat-topped. And they're papular, which just means they're raised. It's this very distinct combination that makes it so visually recognizable. All right, so you get the diagnosis. What's next? Well, this is where patients often find themselves at a crossroads, staring down two completely different philosophies. It really is a tale of two medicines.
And you can see the fundamental difference right here. On one side, you have the conventional approach. Its main focus is managing the symptoms, mostly that itch, with things like topical steroids. The goal really is to make life more bearable, while the disease, which can go on for years, just runs its course. But traditional Chinese medicine, or TCM, takes a totally different path. It's all about finding and treating the root cause. It sees the rash as just a symptom of a deeper imbalance inside the body, and it uses customized herbal formulas to fix that balance.
But you know, theory is one thing. To really see how this plays out, let's follow one patient's actual journey, from total frustration to, well, healing. So this is JP. She's a 54-year-old woman, and when she first walked into a TCM clinic, she had been dealing with this maddeningly itchy rash for 8 long months. She was, as you can imagine, desperate for a solution that actually worked. See, she'd already been down the conventional dermatology route, and honestly, it felt like a dead end. The first steroid cream she was given had, in her own words, no effect. A stronger one, clobetasol, gave her some temporary relief. It flattened a few spots and calmed the itch a bit. But here's the problem. It couldn't stop new, super itchy bumps from popping up all over her body. And to make things worse, it was leaving behind these white spots on her skin. This is what pushed her to look for another way.
And that other way involved looking at her condition through a completely different lens. A lens that was actually developed over 1,000 years ago.
You see, in TCM, this isn't some new, mysterious disease. Not at all. It's been known and treated since the Song Dynasty. They call it Zi Dian Feng, which translates to purple patch wind. And that name is just so incredibly descriptive, right? Purple patch obviously points to the color of the rash. And wind, that's a key concept in TCM for things that appear suddenly, seem to move around the body, and, you guessed it, cause itching.
So the TCM diagnosis for JP wasn't just Lichen Planus, it was way more specific. The practitioner saw a pattern of wind, heat, and damp that had gotten trapped in her skin. This was basically blocking the flow of her vital energy, or qi, in her blood. On top of that, there was a deeper underlying issue, a deficiency of yin and fluids, which you can kind of think of as the body's natural cooling and moisturizing systems running on low. It's this super detailed diagnosis that allows for a treatment that is totally personalized to her.
And once you have that detailed picture, the strategy becomes crystal clear. Just like the famous TCM dermatologist Zhu Renkong said, you treat what you see. The plan is to arrest the wind, dry the dampness, and clear the heat. It's a completely logical, systematic approach based on exactly what's presenting in the patient. So we have the diagnosis and the strategy. What's the actual plan?
Let's take a look at the healing blueprint, a plan designed not just to calm the skin, but to rebalance her entire body from the inside out. JP's treatment followed this really smart, methodical three-phase process. Phase 1 is drain, using specific herbs to push out those acute troublemakers, the wind, heat, and damp. Phase 2 is harmonize. Once things have calmed down, the focus shifts to rebalancing her whole system and fixing that underlying yin deficiency. And finally, Phase 3 is tonify, basically strengthening her body to lock in all that healing and help prevent a relapse.
So the big question, did it work? Well, the results started coming in fast. After just 2 weeks on her personalized herbal formula, JP came back and reported a significant reduction in itch. Now, for someone who'd been suffering for 8 straight months, this wasn't just progress, this was the first real glimmer of hope. And the momentum just kept building. A few weeks after that, the change was even more dramatic. She was now going entire days without any itching at all. Can you just imagine the mental relief of that? That constant, nagging, maddening irritation that had taken over her life was finally breaking. And then came the moment we were all waiting for. By her 4th visit, just 11 weeks into her treatment, she said the 2 magic words: 0 itch. Not just better, not just reduced, gone. The main symptom that had been destroying her quality of life, the one that felt so unbeatable, had been completely wiped out.
I mean, JP's story is just such a powerful example of this, right? How this ancient system of medicine can provide such modern and very real relief.
Let's just look at our whole journey on this timeline, because it's pretty incredible. Week 0, she starts the herbs. By week 2, the itch is way down. By week 7, she's having itch-free days. Week 11, 0 itch, and most of the spots are healing. And by her final visit at week 15, pretty much everything was resolved. That's a remarkable turnaround, especially after where she started.
So what's the big takeaway here? It's that TCM isn't about some single miracle herb or anything like that. It's a rigorous, systematic process. It involves careful observation, a super detailed diagnosis, and then a treatment plan that is tailored specifically to the individual. And as JP's story shows, this ancient framework can offer profound hope and real results, especially for these stubborn conditions where other options just aren't cutting it.
And it really makes you wonder, doesn't it? If an approach that's 1,000 years old can solve a modern dermatological puzzle just like this one, how much more healing wisdom is still out there, just waiting for us to rediscover it in these ancient medical traditions?